What is a stroke? A stroke is, in essence, a brain attack. It can happen to anyone at any time. It occurs when blood flow to an area of the brain is cut off. When this happens, the brain cells are deprived of oxygen and begin to die. When the brain cells die during a stroke, abilities controlled by that area of the brain, such as memory or muscle control, are lost.
The warning signs of a stroke include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body.
I didn't feel anything.
Sudden confusion or trouble speaking or understanding speech.
I have no idea what's going on.
Sudden vision problems in one or both eyes. Sudden difficulty walking or dizziness, loss of balance or problems with coordination, and severe headache with no known cause.
There are two types of stroke, hemorrhagic and ischemic. Hemorrhagic strokes are less common. In fact, only 15% of all strokes are hemorrhagic, but they are responsible for about 40% of all stroke deaths. A hemorrhagic stroke is either a brain aneurysm burst or a weakened blood vessel leak. Blood spills into or around the brain and creates swelling and pressure, damaging cells and tissue in the brain. There are two types of hemorrhagic stroke called intracerebral and subarachnoid. About 80% of strokes are ischemic strokes. Ischemic strokes occur when the arteries to your brain become narrowed or blocked, causing severely reduced blood flow. The most common ischemic strokes include a thrombotic stroke, which occurs when a blood clot forms in one of the arteries that supply blood to your brain. A clot may be caused by fatty deposits that build up in the arteries and cause reduced blood flow, or other artery conditions. Another type of ischemic stroke includes embolic stroke. An embolic stroke occurs when a blood clot or other debris forms away from your brain, commonly in your heart, and is swept through your bloodstream to lodge in narrow brain arteries. This type of blood clot is called an embolus.
According to Mount Sinai School of Medicine, hemorrhagic strokes can be treated by locating the source of the bleed and surgically clipping it and draining the skull to decrease pressure in the brain, blocking off any sources of bleeding. After we perform a procedure, we typically give you medication to reduce blood pressure, pain, anxiety, headaches, and or seizures. Ischemic strokes are treated with a drug called TPA, which works to break up the blood clot. Another treatment option is mechanical thrombectomy, where doctors try removing a large blood clot by sending a wire cage device called the stent retriever to the side of the blood clot vessel in the brain. To remove the clot, doctors thread a catheter through an artery in the groin up to the blocked artery in the brain. The stent opens and grabs the clot, allowing doctors to remove the stent with the trapped clot. Special suction tubes may also be used.
Depending on how severe the stroke is, there is a variety of healthcare professionals that are usually involved in caring for someone who had a stroke, such as a physiotherapist, a speech pathologist, dietitian, social worker, psychologist, and neuropsychologist.
Aspirin use is heavily correlated with strokes. According to a case study, approximately 7.1% of participants frequently misused aspirin. This therefore increases the chance of strokes. In a recent study conducted by researchers affiliated with the American College of Cardiology, it found that more than 1 in 10 Americans without diabetes are misusing aspirin. It is being taken without the advice of a physician among these patients simply because they know of others who are taking the drug. Instead of providing a benefit, aspirin use in these patients can actually pose a risk of adverse side effects that may include bleeding, ulcers, and hepatotoxicity.